Hello everyone, my name is Adam. Today I'm going to talk about Down syndrome. My youngest brother, Joey, was born with Down syndrome. He's also had many other health problems while growing up, but now he's 18 years old and he's getting ready to graduate from high school. First, I'm going to tell you what is Down syndrome. Then I'm going to talk about some of the testing available during pregnancy, some medical problems that Down syndrome children may face, and the education of Down syndrome children, and also adult life of a person with Down syndrome. First though, what is Down syndrome? Dictionary.com defines Down syndrome as a genetic disorder associated with the presence of an extra chromosome 21 which are characterized by mild to severe mental impairment, weak muscle tone, shorter stature, and a flattened facial feature. An article named Down syndrome by the Nomura Foundation states that a typical human has 46 chromosomes, while a person with Down syndrome has 47. Second, the article by the Nomura Foundation discusses several screening and diagnostic tests available during pregnancy. Screening tests can only estimate the risk that a child might have Down syndrome. It doesn't actually diagnose a child with Down syndrome. The first test available is a nuchal translucency testing, which can be performed between 11 and 14 weeks of pregnancy. This test measures the clear space in the tissues behind the baby's neck, and in babies with Down syndrome, this space is typically filled with fluid and appears larger. They use this test along with the mother's age, the baby's gestational age, and blood tests from the mother to calculate the odds that a baby might have Down syndrome. Another screening test available is a multiple marker test. They draw blood from the mother between 15 and 18 weeks of pregnancy and test for 3 or 4 different markers which might show that a baby could have Down syndrome. Between 18 and 20 weeks of pregnancy, a detailed ultrasound can be performed along with multiple blood tests. They use the ultrasound to check for common facial features of a baby with Down syndrome, which are different from normal human beings. Now let's move on to some diagnostic tests. Each of these tests carry major risks, which include preterm labor and miscarriage. First test available is chorionic villus sampling. This test takes the small sample from the placenta around the baby. The next test available, which is probably the most popular one used, is amniocentesis. This test uses a needle which goes through the mother's stomach to draw a sample of the amniotic fluid. The last test used to diagnose Down syndrome is performed after 18 weeks of pregnancy and is called percutaneous umbilical blood sampling. This test uses a needle that goes either through the mother's stomach or through the cervix to draw blood from the baby's umbilical cord. Next, I'm going to discuss some of the medical problems which will be faced by many people with Down syndrome. According to the article, Patient with Down Syndrome Speaks, published in Pulse magazine by Dr. Melanie Wynne-Jones, 40% of children born with Down syndrome will have some type of congenital heart defect. 12% of them have GI problems, and about 30% will have a chance of hypothyroid. Other medical problems that people with Down syndrome may face throughout their life are hearing and vision related issues, obesity, respiratory problems, and an increased chance of infection throughout their life. Now let's talk about the education of a person with Down syndrome. According to Roy Brown in the article Life for Adults with Down syndrome, nowadays children are receiving a much better education than in the past. In the past, children with Down syndrome were typically put in an institution and received no attempt at an education or assistance with any independent living. Now children are living at home for a longer period of time and are receiving a more inclusive education with their peers. They're also being taught how to live more independently with the hopes that one day they'll be able to move out and live on their own. Finally, I'm going to talk about adult life of a person with Down syndrome. Adult life can vary widely due to the person's health, their abilities, and behavior. A person with Down syndrome can go from having mobility problems to being able to compete in Special Olympics. Some even attend colleges, while others have no education at all. And some adults with Down syndrome live in facilities, and others could be married and live by themselves. Most adults with Down syndrome enjoy the same leisure activities that everyone else does. They compete in Special Olympics, cycling, dancing, horseback riding. They enjoy music, painting, acting, and even writing. All of these activities help promote goal setting, exploration, planning, social inclusion, and individualism. In conclusion, people with Down syndrome have grown to become independent individuals who have a chance at the same opportunities as everyone else. Parents have many options to discover whether or not their child may or may not have Down syndrome. And although people with Down syndrome may face medical problems throughout their life, there's lots that we can do with modern medicine to help them. Children with Down syndrome are now receiving more educational opportunities than the past, which has helped them to become more independent individuals. And as adults, people with Down syndrome are just like you and I. They go to school, they go to work, they even get married and have kids.